right? That classic burning. And yeah, that's definitely a major player.
Absolutely. Heartburn, or pyrosis as we call it, is the hallmark symptom. It's that classic burning feeling deep in the chest, right behind the breastbone, often gets worse after meals or when you lie down. Then there's regurgitation. It's exactly what it sounds like, that unpleasant experience of sour or bitter liquid, could be acid or bits of food, rising up into your throat or mouth.
Ugh, yeah.
And for some people, they might experience dysphagia, which is difficulty swallowing. That can happen if the esophagus gets inflamed or even narrowed over time from the acid.
But here's where it gets really interesting, I think. GERD doesn't just cause those classic symptoms. It can, disguise itself, right? Show up in ways you never expect, like battling a chronic cough for ages and finding out it's actually reflux.
Absolutely. We call these atypical or extraesophageal symptoms, precisely because they happen outside the esophagus. We often see respiratory symptoms like that chronic nagging cough you mentioned, or it can make existing asthma worse. Sometimes even recurrent pneumonia, believe it or not, from tiny amounts of acid getting into the lungs.
Wow.
And in terms of ENT symptoms, ear, nose, and throat GERD can cause laryngitis, persistent hoarseness, that weird feeling of a lump in your throat, globus sensation.
Oh yeah, I've heard of that.
Chronic sore throat, and even dental erosions. Constant acid exposure can literally wear away tooth enamel. So yeah, these things that seem totally unrelated can be directly linked back to reflux.
Okay, so with all these different symptoms, some obvious, some really not, how do we know when it's just, annoying versus something we really need to get checked out? What are the red flags, the alarm bells?
That's a critical point. These are what we call alarm symptoms, and they really do demand prompt medical evaluation. They include progressive difficulty swallowing, meaning dysphagia, that gets steadily worse, or painful swallowing, which we call odynophagia.
Okay.
Unintentional weight loss, losing weight without trying. That's a big red flag. And crucially, any signs of internal bleeding, vomiting blood, which is hematemesis, or having black tarry stools called melena, that indicates bleeding somewhere in the digestive tract.
Definitely serious signs.
Very. And lastly, anemia, low blood count, which could be from chronic, slow blood loss, even if you don't see obvious bleeding. These signs should never, ever be ignored. Seriously.